Once again, thank you so much for tuning in to my YouTube channel. Thank you for constantly subscribing, liking, and following. Today we are going to concentrate more on the arterial supply of the breast, the venous drainage of the breast, and also the lymphatic drainage of the breast, and we shall also look at their clinical significances. Right from the heart, we have the aortic arch, which is actually divided into three branches. The two branches go on to the left hand side. However, on the right hand side, we have the branch of the brachiocephalic trunk. Now, the brachiocephalic trunk divides into two blood vessels. That is the common carotid, and it also divides into the subclavian artery. Now, the subclavian artery has a branch of the internal thoracic artery. Now, the internal thoracic artery goes into the thorax region and penetrates downwards. And if you look at point 2 there, it says that we have the perforating branches of the internal thoracic artery, which is a branch of the subclavian artery. These perforating branches, as they go into the thorax, they perforate through the intercostal spaces in the second, third, and fourth branches, and are especially large, and they supply the median part of the breast. Then, if you continue, the subclavian immediately after the clavicle, after the moment the artery bypasses the clavicle, it becomes the axillary artery. The axillary artery gives off a superior thoracic artery, which also supplies the areas in the pectoral region. Then it also continues and gives off another branch that we call the thoracoacromial artery. Now, the thoracoacromial artery has about 4 branches, and one of the branches is the pectoral branch. So specifically, the pectoral branch of the thoracoacromial artery is the one that supplies the upper part of the breast, or the superior part of the breast. The axillary artery still continues and gives off another branch that we call the lateral thoracic artery. Now, the branches of the lateral thoracic artery mainly supply the lateral part of the breast. However, the lateral part of the breast is also supplied by the lateral branches of the posterior intercostal arteries. There are some muscles that come from behind. So those are the posterior intercostal muscles, and actually they supply the lower and lateral parts of the breast. So that is the arterial supply. Then the venous drainage of the breast, we have mainly, actually it is also similar to the arterial supply. We only change the word vein to artery. So just like we talked about the axillary artery, we also have the axillary vein, which receives blood from its branches. And some of the branches we talked about the thoracoacromial, we talked about the lateral thoracic. All those branches now drain back into the vein. It is just a matter of changing the names. Even the internal thoracic is drained back into by the branches that pass through the intercostal spaces, and the same applies to the intercostal veins, which are actually the posterior intercostal veins. So it becomes very simple. You just change where there is artery, you change and put there vein. Now we have the nervous supply of the breast. Now the breast, just like that, we looked at the brachial For those that did not download the video, please go and look for that video about the simplified drawing of brachial by Jordan Galiwango Doctor. Now the nerve supply of the breast. Now the breast is basically separated by the anterior and lateral branches of the 4th, 5th, and 6th intercostal nerves. And these nerves actually have sensory fibers that go to the skin of the breast. However, they also have autonomic fibers to the smooth muscles, and we know that smooth muscles are mainly found on the nipple of the breast, and also the blood vessels. However, it is very important to note that the nerves have no role in the secretion of milk, because the secretion of milk is mainly controlled by prolactin hormone. If you look at prolactin hormone, it is normally secreted immediately after birth or days after birth, because it is actually its production is inhibited by the other hormones that are secreted during birth. Now we are going on to a very important topic of lymphatic drainage of the breast. Now, the lymphatic drainage of the breast, actually the breast has lymphatic vessels, it has lymph nodes also. Now, the lymphatic vessels are arranged into 4 plexus. We have the subcutaneous plexus, and this plexus actually supplies the skin and the subcutaneous tissue, but with exception of the nipple and the areola. Actually, it sends efferent lymphatics to the nearby axillary lymph nodes. We have then another plexus that we call the subareolar plexus of Sappi. Now, the subareolar plexus of Sappi drains the nipple, the areola, and the parenchyma of the breast. Then we also have the perilobular plexus, which we also call the parenchymatous plexus. Now, this one surrounds the lobules of the mammary gland and communicates with the subareolar and the deep fascia lymphatic plexus. We also have the deep fascia plexus of the submammary plexus. This one lies on the pectoral fascia covering the pectoralis major. It actually communicates with the perilobular and the subareolar plexuses. Now, these plexuses are the ones that transport the lymph away from the breast. However, they drain into the lymph nodes. Now, it is also very important to know these lymph nodes. Now, the lymph drained by the above lymphatic plexuses is carried by the lymph vessels to large number of lymph nodes as follows. 75% of the lymph drains into the axillary lymph nodes, and the axillary lymph nodes may include the pectoral, apical lymph nodes, the posterior axillary, the anterior axillary, as we shall see. And then 20% of the lymph drains in the internal mammary lymph nodes, and then 5% drains into the post-intercostal and the subscapular and the supraclavial lymph nodes. Now, if you look at the lymphatic drainage of different parts of the breast, we begin with the nipple and the areola. The nipple and the areola, just like we said, is drained by the subareolar plexus of Sappi, from which the lymphatics pass directly to the pectoral and apical groups of the axillary nodes. So, we shall have our lymph being taken to the pectoral lymph nodes, or you can call them the anterior axillary lymph nodes. Then the skin and the subcutaneous tissue, this one is actually mainly associated with the subcutaneous plexus, and this one actually radiates in different ways. Now, if you look at this diagram, we realize that the upper lateral quadrant drains into the pectoral group of the axillary lymph nodes, that is the anterior. Then the lower lateral quadrant drains into the subscapular group. The subscapular group is the posterior axillary lymph nodes. Now, the upper medial quadrant drains into the internal mammary lymph nodes of the same side. However, they can also they have some lymphatics that cross to the opposite breast. And then the lower medial quadrant drains into the mediastinal lymph nodes. However, some lymphs are also transported downwards via the rectus sheath, and then they reach the liver. Now, we also have the breast parenchyma. We say the breast parenchyma is also drained by the perilobular lymphatic plexus, which communicates freely with the subareola, just like we said, and the deep fascia, and is drained into the lymphatic nodes. And you realize that the lateral half mainly drains into the pectoral group of the axillary lymph nodes. The upper medial part drains into the internal mammary lymph nodes, of the same side or the opposite side, and then the lower medial part drains into the rectus sheath and also the liver. Now, why should we strain? Now, the question would be, do I need to remember all this? My answer would be most probably, because this is the key for the determination of the metastasis of cancers. Now, you realize that cancers move or metastasize through the lymph. Now, in case a woman has, or a person has maybe a tumor in the upper lateral quadrant, we expect the metastasis to take place into the pectoral lymph nodes or in the anterior axillary lymph nodes. In case they have a tumor in the lower lateral quadrant, we expect it to be in the posterior axillary lymph nodes. In case they have, so these just direct us to where the metastasis of the cancer might actually take place. So it is very key, because once you realize a tumor in that area, of course, those tumors are normally associated with the enlarging of these lymph nodes. So in case the lymph nodes don't enlarge, that means there is a problem with that, maybe a bacterial or a tumor causing that. Now, you realize that what they do is what they call a sentinel lymph node biopsy. Now, sentinel lymph node biopsy, they can get maybe a dye or a radioactive substance, and it is injected near the place where you have the tumor. Now, we expect, if it is injected there, we expect that dye to travel in following where the direction of the metastasis of the tumor, of the cancer. And that one, now, if you check, if you find that the lymph nodes that you're expecting to be affected have that dye, that means they are removed, those lymph nodes are removed, and then they are taken for the test. If they find that those lymph nodes have cancer, therefore, we expect that the cancer could have spread even to the other lymph nodes. Therefore, we shall remove the entire axillary lymph nodes. However, if we realize that they are not, therefore, we can only remove those ones plus the tumor. And that one we would recommend lumpectomy. So, it is very important for us to know where the drainage goes, because once you remove all the lymphatics, the lymph nodes of the breast, without first carrying out a sentinel biopsy, you are going to realize that the lady will have, or the person who has been operated on will have lymphedema. And lymphedema is the enlarging of the hand, and that one we can do nothing much about it. So it is very important to first check. However, if all have been affected, it is okay. We can just forego that. Thank you so much for watching. Continue subscribing and liking. More and more